What we're going to do today is tape for an individual who has pain right here over the navicular. Now she's had this for since March, so for about 7 months now. And one of the things that they did was put an orthotic in her, which made no change. She also reports that there's a bone that is actually sitting down here. So the cause or the etiology may be certainly considered in this, and it may be changing the mechanics. But what we're going to really try and do is reduce the pain, because we've noticed we had to change the position of the talar crural joint, and she had pain going up into posterior tibialis. Okay. Also pain that will run along the bottom of the Flexor Hallucis Longus. So the way that we're going to tape this today is as such. I'm going to grab my tape and I'm going to tear the end, so my 2-inch anchor. Okay, I want the foot in a relaxed position, so I'm going to relax the muscles and tendons that we just discussed. First piece, I want to find the bone and the muscle, okay, and I want the tape to be about halfway on the bone and muscle. And if you notice, it's going to be approximately 4.5 finger lengths above the medial malleolus. Paper off tension as we're pulling down, okay? And I want to try and come over that navicular and onto the bottom of the foot. So this is approximately 10% tension. Smooth this down. The second piece, so this is one that I would typically do for tibialis posterior by itself on the distal end. The second piece is one that I would typically do by itself for Flexor Hallucis Longus. I'm combining these to help reduce the pain that's occurring over this area of her foot. So I'm trying to reduce these two tendons. So I'm going to put this kind of here at the base of the toe. And then again, paper off tension. And I want this to come over kind of the posterior medial portion of the calcaneus, or the heel bone, and I want to kind of take it behind the heel. That's going to actually have it act as an anchor. Now you notice I have what's called bowstrung here. That's because I want to try and create even tension over this area. So I'm now going to push up and in and then flatten this out. Okay, again, 10% tension. And again, what I've done is I've combined tibialis posterior distal with Flexor Hallucis Longus. And this should actually help to reduce this and help reduce her need over time for an orthotic. This can help actually strengthen this musculature and shorten this musculature. So hopefully we can start reducing some of the pain in this area for this individual.